Hello, good evening to everyone who is watching our live stream today. Let me take off my mask, actually. My name is Jamela Rose, and I am the Deputy Public Advocate for Civic and Community Empowerment at the Office of the New York City Public Advocate. And today, our panel discussion is about the rebirth of a movement, equity and justice for Black moms in New York City. Before we kick off our panel, I would like to first introduce to you Councilmember Amanda Farias, who is the co-chair of the New York City Council Women's Caucus.
Thank you so much, Deputy Public Advocate, for having me here this evening. And shout out to our Public Advocate, Jumani Williams, for also inviting me to give some opening remarks. I'm really proud to be here as not only a council member, but the co-chair of the Women's Caucus of New York City Council. Women are the backbone of our communities and our families. And we have seen the divestment of Black families and primarily Black women across many sectors. But today we're focused on healthcare, maternal mortality, and birth justice. The movement for birth justice is a part of a movement against reproductive oppression. It aims to dismantle inequalities of race, class, gender, and sexuality that lead to negative birth experiences, especially for women of color, low-income women, immigrant women, queer and trans folks, and many others. Advocating for birth justice involves educating the community and challenging abuses by medical personnel and overuse of medical interventions. It involves advocating for universal access to culturally appropriate, women-centered healthcare. That's something that, as co-chair of the Women's Caucus, we are prioritizing even before I became co-chair as a priority for the entire caucus and the city council. It includes the right to choose whether or not to carry a pregnancy, choose when, where, how, or with whom to birth, including access to traditional and indigenous birth workers, such as midwives and doulas, and the right to breastfeeding support. I'm excited about the dialogue we're about to partake in tonight, and I look forward to being a partner in this fight for birth justice. Local governments need to take active steps to document Black, African American, Caribbean, multiracial women's experiences of pregnancy and childbirth. We need to investigate factors contributing to positive pregnancy outcomes and postpartum physical and mental health, and to explore the impact of medicalization and medical access on Black women's experiences of childbirth. I know we can do this together with focuses on making hospital and birth centers accountable to Black pregnant women and communities, improve relationships between staff and Black pregnant women through mandatory training on cultural humility and holistic care, adoption of trauma-informed protocols, and partnership with organizations serving Black communities. Once again, I look forward to working in partnership, fighting as much as we can, both at the city level and advocacy on the state and federal level, and working in partnership with all of you here this evening. Thank you for having me, and I look forward to the conversation.
Thank you so much, Council Member. I'm going to turn it over to our Public Advocate who has joined us.
Can you hear me? Oh, awesome. Thank you so much. Peace and blessings, everyone. Thanks to Council Member for helping us kick off, and thank you to Jamela, who's doing an awesome job in the office on these issues, and the panelists who we'll be hearing from. This is obviously screaming important topic. Birth equity is a social justice issue, as was mentioned. It's one that's too often ignored. It's facing people too often who are unheard. It's one that is personal to so many New Yorkers. I never knew how personal it would be for myself and my family. And I appreciate everyone who's continued to pray for myself, my wife, and my beautiful newborn, who we're hoping will be home soon. Maternal health, maternal mortality, birth equity, these are issues that we have to continue to talk about, and their truths and people's truths need to be heard. In the United States, Black women are 3 to 4 times more likely to die of pregnancy-related complications than their white counterparts. In New York City, that's even worse, 8 to 12 times more likely to die during childbirth. The outcomes remain the same regardless of socioeconomic status and quality of health insurance, to name a few. It's time to address the outcomes in earnest. Unfortunately, there has been a racial disparity in maternal morbidity and maternal rates for a very long time in this country, for over a century. Repeated studies have shown racism and discrimination lay at the root of this inequity. My office has launched a campaign to raise awareness about the severity of these issues. We're calling on city, state, and federal government to take steps and tangible solutions to address the issues. We have legislation to help get it done. One establishes a maternal health bill of rights and provides that pregnant individuals are informed of those rights. The second addresses inequities and issues that primarily rise post-pregnancy related to re-entry to the workplace. It also have a resolution to ask the Congress and President to sign the Black Maternal Health Omnibus of 2021. Together with this coalition as allies across the city and state, we're going to get this done this year with and for Black and brown women in honor of too many that we have lost. I did hear today that the mayor is planning to move forward on many of the things that he promised as doulas. So we want to hold him accountable to that and thank him if we're going to push forward. Birth equity is a social justice issue. So I want to thank Councilmember Farias on behalf of herself and the New York City Council Women's Caucus, as well as co-chair Councilmember Lewis. I want to thank Ancient Song Doula Services, Brooklyn Perinatal Network, Earth App, Black Women's Political Club, Bronx Healthy Start Partnerships at Einstein College of Medicine, Supporting Healthy Relationships at Montefiore Medical Center, NYCLU, Association of Black Social Workers, NYC Chapter, CVH, and NYSDA. Thank you all, and thank you to the panelists who are here and the people who are listening and who are going to take this information to help themselves and also continue to fight. Peace and blessings, everyone. Thank you so much.
Okay, thank you so much, Public Advocate. I know you have a lot on your plate right now, and so you're leaving to go to your next appointment. And also, thank you so much, Councilmember Farias, for joining us this evening. I know this is the beginning of a great relationship between our office and the Women's Caucus as well as we work towards getting these bills passed.
Absolutely. Thank you so much.
Thank you. Let's just give them a second to leave. Okay, they are gone. All right, so now we are here. It is 6:42. We're a little behind on our schedule, but we're going to get through these questions. We have a good group of organizations. I really want to say thank you to all of the partnered organizations that have helped us to do outreach. We have a lot of people watching. I see some on Facebook. This is streaming also on LinkedIn as well as YouTube. And so I'm looking forward to all of the questions that people will ask as we get through the first set of questions and then open it up to the audience. So if you have questions and you're in the audience now, even before we start to talk, just type them in the chat and we'll get to them once we get to the Q&A section of the program. So I want to introduce the panelists who we have here tonight. And I will start by saying the three women that we have in front of us are experts and advocates and activists in this field. They have been working on birth justice and birth equity. I know Ngozi has been working for more than 30 years on birth equity. And she's a mother of the movement. We have Kimberly Seals Allers, the founder of Earth App, and Kimberly has been doing a lot of amazing work, and it was even given a shout out by Vice President Kamala Harris. And then we have Chanel Portia, who's a nationally known advocate across the activists. I consider you an activist, Chanel. You've been traveling nationally around the country and giving your expertise to people, and all of you are such amazing women. And I wanted to give you a minute to kind of introduce yourself to the audience so people know who they're hearing from. So as they begin to type their questions, they know who to direct them to. So starting with you, Ngozi Moses, from the CEO of BPN. Do you want to just give us a brief intro of who you are? And take your mic off of mute.
Thank you. I'm the founding executive director of the Brooklyn Perinatal Network. I represent a collective voice. We've always done everything we do with coalitions. And currently, there's the Brooklyn Coalition for Health Equity for Women and Families with a leadership team of 5 community-based organizations. And so I speak with that voice, not just for Brooklyn Perinatal, but for CBOs, particularly those invested in working with pregnant women, those women in childbearing age who intend to get pregnant, and those who are parenting infants and young children, including teenagers who will be the new mothers. So that's my 1 minute or half a minute intro. I have a lot more to say and looking forward to more time.
Thank you. Kimberly.
Good evening, everyone. So honored to be here, and thank you to Jamela and the Public Advocate's Office for organizing. My name is Kimberly Seals. I am the founder of Earth, which is like the word birth, but we dropped the B for bias. It is the first of its kind Yelp-like review and rating platform for Black and Brown women and birthing people to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians, really as a tool to drive transparency and more accountability in the medical system, but also to center our community power and to say we are powerful consumers and we need to inform and protect each other, and using technology as a way to do that. I'm also the host of Birthright, a podcast about joy and healing in Black birth, also another grant-funded project through my nonprofit where we focus on countering the doom and gloom narrative often common in Black maternal health by sharing positive Black birth stories and saying that we can learn from our successes and in Black birth as well. So I'm excited to be here and to talk about the power of community and share more about my body of work. Thank you.
Thanks so much, Kimberly. And Chanel, Portia, Albert.
Greetings, everyone. Thank you all so much. It's an honor to be on the panel with Mrs. Moses and Kimberly as we work to shift the narrative and what it really means to center birth equity. My name is Chanel Portia Albert. I'm the founder and CEO of Ancient Song. We're a full spectrum reproductive justice organization. We offer full spectrum direct doula services. Our work is centered on education and advocacy. And so really looking at the ways in which doulas offer intersectional perspective in the birth room, and what does that mean to use that knowledge to therefore transform institutional biases and oppression that individuals face when they're working into the healthcare system and seeking out reproductive healthcare. And so super honored to be here and looking forward to the conversation.
Okay, great. So let's get started. We know it's interesting because our first question is really about the reproductive justice movement and how it's historically addressed birthing inequities and issues of racial and social justice up until now. And so when I ask that question and we talk about reproductive justice, people tend to have their own ideas of what that actually means versus what we're talking about today. So starting with you, Kimberly, how do you think the reproductive justice movement has changed or morphed or address some of these issues that we're going to be discussing?
Well, I think the most important thing the reproductive justice movement has done is define reproductive justice, right? Prior to this framework, we were stuck in a reproductive rights conversation, which was narrowly focused on the right not to get pregnant, really important, the right to end the unwanted pregnancy, also really important, but not the broader sense of rights, the intersections of race, class, environment, your right to parent and to be healthy, to feel safe. And so I think one of the things that have been so important is that when we're talking specifically about Black and Brown people, that we cannot have such a narrow lens around reproductive rights, that we need this broader reproductive justice framework. And we are eternally grateful to Sister Song and the collective for creating this kind of new way of looking at it. And so, the ways that we have advanced this conversation about what does reproductive justice really look like is one of the most important contributions to the birth justice and birth equity movement, because it allows us to understand the intersections of it all, right? And the ways that folks are now wanting to talk about social determinants of health. And, now we are having a more holistic conversation, but one that certainly centers the impact of racism, as well as class, in how we are able to access, use, and live out our reproductive rights. And I think that is tremendous for us to use as a framework moving forward. And it didn't exist until Black women made it happen, which is also an important lesson.
Thank you for that. And Ngozi, I wanna come to you next, because I feel like, and also just you being a household name. At least in my household, you were a household name, and you've been at this game for a really, really long time. You were shouting about infant mortality and Black maternal health before it was sexy, before it was a trend. And so, taking a stab at the first question, what are your thoughts on how the previous movement has addressed or not addressed the issues that we're talking about today in terms of racial justice and social justice? And what are your thoughts on it?
Thank you for that. I remember Marco Mason, who was a mentor of mine when I first came to the United States over 40 years ago and got into this. He said 30 years ago, we were still, that's 30, 40 years ago, he said 30 years ago, we were addressing the things we're addressing now. 30 years forward, we're still addressing the same thing. And just younger people, a change of voices. And so the inequities that we experience is requires a paradigm shift in influence and power and resources. And not much that's changed, as Sister Song group has demonstrated with all the organizing. From the early days of the hysterical movement, much of what that was happening in terms of disparities and inequities in quality of care are still happening to a greater degree, just that they're now more observant because they're voices that are pointedly addressing the issues. So I would say that there's still some ways to go. There's been some little change, certainly not enough change. Women are still not being respected the way that they should. Their voices are not being heard the way that it should. We have doulas, which I'm sure Chanel will focus on more, fighting to advocate for women who can't speak for themselves in the labor room because of the pain and everything else, or because of not just knowing what to say. And on my part, I am focused on empowering community-based organizations and advocates who see these women in the front line, in the trenches, and knowing that these organizations are overburdened and distressed and under-resourced, and still needing to put up a fight and a battle for the women in the community. So as I proceed through talking about the present, past, and future, I will tend to focus on the need for the frontline services of community-based organization and folks like Chanel, who started her advocacy work in her household, in her home, with her own passion, to really have access to the resources to be able to lift our voice and our presence up, to get a place at the table where the decisions are being made about the resources and the policies that affect the inequities and that we are addressing today.
Okay, I'm going to go to Chanel, and then we're going to get into what those inequities are, because I can almost feel like I hear the people in the audience like, well, what are the inequities? But Chanel, go ahead. You take a stab at the first question.
I think to really veggie back off of what Kimberly and Mrs. Moses has articulated is that when I think about the past, I think about our ancestors, but I also think about the Black women who have and continue to be the trailblazers for really centering community-centered care and what that collective care looks like, right? And so throughout, the various different iterations that we have experienced, fluctuations in social justice movements, there have always been Black women who have stood at the forefront, who have laid the groundwork for the next generation to really be able to lift up, what does it mean to center care? What does it mean to center love? What does it mean to center hope in times of distress? You know what I mean? So when I came into this movement, seeing Mrs. Moses be a trailblazer at the table and really like shut down folks who were like, she was like, listen, I know I'm about my business. I don't have time for you folks and all of this extra stuff. Like, let's get this work popping, because while we're sitting there and while you're talking about what you want to do, I'm here with people who need these services right now, right? And so in looking at that, and seeing that as an example, that has really been an example for how we have and continue to shift the playing field with using community organizing as a strategy, with using social media as a tool, with honoring the first 12 Black women who started the reproductive justice movement and who have really and working with them, getting to work with Tony Bond and getting to work with Loretta Ross and getting to work with all these different individuals who are so powerful and unapologetic about what it is that we need to center ourselves, to center our communities, to live in places that are free from harm and unprovoked violence, to have a child, to not have a child, and to parent children in an affirming way. Continues to be like the framework for, challenging institutional racism and biases, provider trauma, that is thereby reflected onto the patients that they see every day. And then also policy reform. Like, what does it mean then to really use all of those things and those tools, and to give us a blueprint for what it means to do that on a city, state, and federal level?
Oh my gosh, I feel like you just hit on so much, and it's not lost on me that you said veggie back either. I was like, I need to write this down, veggie back. But yes, okay, we can veggie back and not piggyback. Okay, but as you're talking about as we're talking about city, state, and federal, that's even, and I don't want to talk too much because I know we're already short on time, but even as we're all doing things, we have a Brooklyn Borough president, amazing. He's doing some work. He's focusing on building out infrastructure. We have the Bronx Borough president, Vanessa Gibson, working on some things. We have organizers here, organizers there. The Congresswoman, Yvette Clarke, is doing stuff. Kirsten Gillibrand is doing stuff on the Senate level. But it's like, how do we come together, and create like this one blueprint, just like you said, where we're all like different spokes in the wheel, but the wheel is turning, and, we're moving forward. Black women and women of color who are experiencing adverse outcomes, we're all moving forward in the process. So with that said, I think it's easier for us to kind of segue into this next part of the conversation, which is, despite the advances in the medical field and technology, what are the problems that we are still facing today in practice, in policy, and with the people that we serve? And when I say people, I mean, just like you said, Ngozi, you're with the groups that are on the front line. So what are we still seeing when we're on the front lines? What are we still seeing? Where are the inadequacies in the policies that we currently have, and also in practice? And how has like technology and assisted with that, or not helped, or how should it assist?
Well, if you want me to go first, since you called my name, I would like to veggie back on what you just talked about, all these partners, city, state, federal, and community doing things. In 2000 or thereabout, Brooklyn Perinatal and its coalition of partners, then called the Infant Mortality Reduction Initiative, and aka the Brooklyn Task Force for Infant Mortality, Infant Morbidity and Maternal Mortality, reached out to City Council to say, hey, City Council, it's time for the council to put some money into our communities to fund community-based organization work on maternal and child health, because the state had just pulled some monies from Brooklyn Perinatal and a number of partners to put it elsewhere that they think it was needed. And the City Council Infant Mortality Reduction Program was born and has lasted to date, with variations in how the funding is provided annually and then to the Department of Health. It just seeks to say that community-based organization can take the initiative and reach out across the board, even as administrations change. But we do need financial support, because we're often funded fragmentally to deliver services and count the widgets. And when we do the advocacy like we did for the Infant Mortality Reduction Initiative, which is now a city council initiative and which has boarded a Department of Health program called the Maternal Infant Care, we did that on the backs of community-based organizations working in the trenches, just advocating on our own time. So what needs to change is that there needs to be champions in places of power who recognize the need to fund the capacity in the community-based organization to, one, do the work we need to do effectively and with the tools and the processes that we need that show we can provide quality services, but also enable us to advocate, because if we can do some without the monies to advocate, what much more can we do if we can sleep at night and wake up in the morning fresh because we have money to help to do some of the advocacy? Right now, a lot of us don't get sleep because at night after we've done our work, that's when we're planning and getting organized for the next day to advocate. Now, what is important right now in terms of the present is that there are lots of federal monies that are going to be pouring, has already begun to pour into cities and state administrations and so. And the voice for CBOs for that money to come directly to us is missing. We were not at the table. We were not invited to the table. The large organizations that are the usual suspects will get this money, and then they will decide how to trickle it down to us in much the same fragmented way that it has always come down. So there need to be change in policies and in programs, and we need to be able to reach the Gillibrand and all the others. Senator Zellner and Mamiri is trying to get a bill into the state legislature, which I'll address towards the end of the program. But the thing is that in the past, community-based organizations who are in the trenches and in the front line and see many of the disparities and the maternal health population before they hit the crisis of the ER or the crisis and in the delivery. We're not adequately and sustainably supported to be able to do the work. And it continues up to today, and that needs to change. And there are evidence-based approaches that are available now. So pressing on our elected officials and encouraging them to work in a way that engages the community voices in a respectful way, just as we need to engage the voices of women who are delivering in a respectful way, is significantly important. And often elected officials come to us when they need a cause, but we keep knocking on their door all year long just to get to listen, and that needs to change. And the how, I don't know, but I know that if we can come together with voice and give the same message that community engagement, intelligence is valuable and need to be respected, that might be helpful.
That's great feedback, Ngozi. I love that. And it's true, and it's not fair that, like, if elected officials were to just reach out to you only when they need you for a cause, but at the same time, we're not bringing you to the table as we're drafting legislation and thinking critically about how the city can best support maternal healthy birth outcomes. So with that, I who wants to take the next? Who wants to take it? Kimberly or Chanel? Who wants to go next?
I'll go next. I mean, just, and I won't say veggie backing, but although I do really want to say veggie backing, but just to build on what Mama Ngozi was saying around, the tools that we have. And I think this is when we're asking how, part of the how is by leveraging technology, right? It allows us to achieve scale. Right. And so, yes, it is one thing to share one story of what's happening and take that to a policymaker. But what happens when we have thousands and thousands of experiences in a technology platform like Earth, where we can now turn those reviews into data? And so now it becomes something that is almost too much to ignore. And so what we really, one of the many things, I just want to be clear about that we need around, that we're focused on, is adding scale and then activating consumer forces. One thing that I heard so clearly and what Mama Ngozi was saying was this idea that we've been asking for money. We've been asking for policy. We've been asking. And technology allows us to tap in something that we haven't leveraged, which is our consumer power, right? And Black people are very powerful as consumers. And as a former senior editor at Essence Magazine, I remind people that I know how much money people pay to market to Black women. We're a very powerful consumer bloc, but we haven't activated that collective power in service of birth equity and justice. And so what we do at Earth is really try to capture and be a tool for that consumer power, for our collective power, to take those reviews, to invite people to download the app, leave your experiences, tell us what's happening. So the next time we go to that policymaker, we're not going there with the 2 or 3 stories, or even the 10 or 12. We have thousands of stories and experiences and data. How many people are saying their pain levels are being dismissed? We ask very specific questions in Earth Structured Birth Review. And so we are actually breaking down what bias looks like, identifying practice behaviors. We get to people name names in Earth, so we know who are repeat offenders, as they say. We can show frequency, we can show patterns. This is how many times people said they was yelled at, which actually right now is the number 2 negative experience being reported in the app. So we have to leverage all the things, and that includes technology. And then for me, the second piece of how is about transparency and community accountability. These folks have not been held accountable. Even if we get a policy that mandates an anti-bias training, nobody is holding them accountable, and nobody is checking back in to see if that training actually impacted the patient experience of Black and Brown folks. Nobody checks back in to see if it's working. This is one area where suddenly hospitals have zero evaluation. Everything else has to be measured. But when it comes to showing up and being respectful to Black birthing people, somehow they're allowed to train and pray. Hope it worked. We'll just tick the box. We did the training. And Earth is saying no more. We have a new partnership with the March of Dimes, which is how we got the mention from the Vice President's Maternal Health Day of Action, where they're using Earth as that community monitoring mechanism, a technology-based way to constantly get community feedback. And so we have to also bring all the things to this fight for birth equity and justice, technology being one of them, Earth being one of those digital platforms. But I think if we can activate all the power that we have, including our consumer power, that we can drive transparency and accountability by using technology and our consumer power, that now we have something new to add to our toolkit. To all the things that we're doing, we're also adding something new, and that we are not just doing the same things, expecting different results, right? And so that is part of what is happening in the present. And I'm excited by all my sister founders and the ways that we are bringing technology to this space, and the promise of how we can bring our collective experiences, how we can start generating data that is truly evidence-based on us and not evidence-based on whatever that other evidence-based was, because it was never really based on us, right? And that includes even, and I'll say this as a way to pass it off to Chanel, the value of doulas, right? We accept reviews in Earth from birthing parents, fathers, birthing partners, doulas, and hospital-based midwives. This 360 perspective that we take the hospitals to identify patterns and to really help them develop a hospital improvement plan that's rooted in our lived experience, right? Too much data that was never really based on us. And so that's really the third thing. How do we create this new evidence base, but let it be evidence rooted in our lived experience of care, that we don't wait until the next maternal mortality review board to analyze care. This idea that death is the trigger for analysis is deeply troubling and absolutely unacceptable, right? With Earth, we say we can learn from the living. How do we take this first ever national repository of lived experiences of care from Black and Brown birthing folks and use that lived experience to better inform care, to drive policy decisions, hold folks accountable, and leverage our consumer power? So these are part of the many things that we are working on, in addition to the great work of all of my fellow panelists. But I think looking at the value of technology and tapping into our community power collectively is an important addition to our very robust toolkit.
Thank you for that. That was good, and that was a lot. Not in a bad way, in a great way. And I know you said you were passing it over to Chanel. So Chanel, if you want to pick up the question from your perspectives.
Yeah, I mean, I definitely agree with what has been said, and would add like leveraging that those tools, that data collection, right? That the tech to be able to inform how the implementation and accountability takes place within the policy structures, right? And so what I've seen, basically is an influx of legislative policies centered around Black maternal health, centered around racism and implicit bias, centered around maternal mortality review committees, right? But then when it comes to the implementation and accountability around them, that's where it starts to lack, right? You can have all the doula Medicaid bills you want. You can have all of the information that's centered around, oh, have a doula, everybody should have the doula. But if the organizations, the community-based organizations don't have the proper infrastructure in order to be able to serve that population, what you're really doing is putting a further burden on the community, which then causes further problems for those who want to be served, who are trying to receive the services. When you say, oh, we need doula Medicaid reimbursement, and then, legislation passes, but then the reimbursement rate is not that of a living wage, well, then how is someone supposed to live in New York City, especially now with 7% inflation in gas? I don't even want to talk about gas. Everybody's starting to walk. But with gas prices that are skyrocket, the average individual can't function in a way that where they're able to center themselves and then go out into community and center community in meaningful ways. And so we really, while I think doulas are great, I'm a doula, I've trained doulas, but I think we have to look at the fact that doulas are not the only sole answer to the problem. What we really need is a complete overhaul of the system, and the ways in which it functions, right? From forms of education of everybody who comes in contact with someone who is pregnant, to the institutions and the policies that they have within them when it comes to when someone presents when they're pregnant, when they present during the postpartum period. What does it look like for the overuse of technology in those spaces that are at the detriment of individuals who are trying to center themselves during their pregnancy and during the postpartum period. And then looking at the ways in which historically, again, this is not a new conversation. When I got into this work, the biggest conversation was the infant maternal mortality rate, right? And that was back in 2008, and it continues to be that same thing. And now when we look at reports where during the pandemic, the maternal mortality rate has risen by 12%, right? That shows us that it's not just a matter of us looking at just one individual or one organization or one answer to the problem. It has to be something that is collective. And I really like the fact that, Mrs. Moses brought up, we have Gillibrand who's doing this. We have city council members who are doing that. We have this one who's doing this. But what does it mean for us to come together and really create a universal platform? Because that's what's missing across the board federally as well, right? The problem is that you can go to one hospital and you can have one policy, and then you can go across the street to the next hospital and there's another policy for something else, right? And there's no form of accountability to communities. So then you have these institutions that are in communities, but they're not extensions of the communities. And that's where I think, the three-pronged approach of having, Kimberly's The Earth app being there that sets that tone for accountability, where you have community stakeholders who are really bringing their consumer power behind things, who are backing up, and providing the data to institutions to say, yeah, okay, you said you were doing this, but in reality, this is really happening, right? And how are you going to take the next steps to that? Oh, well, the next step is, how about you have these community-based organizations that are already in the community who have been doing the work, fund them at a rate where they can be sustainable and they can continue to provide that work in a way that is meaningful, right? That has community at its core, right? And continues to build that up. And then let's talk about what it means to revisit this on a consistent basis, because it's not a one-time event. It's just like taking a racism and implicit bias training is not a checkbox. You know what I mean? This is something that has to continually flow and continually be reevaluated. And so I think we're consistently in that reevaluation phase. And now it's about really laying the groundwork and the blueprint for saying, what does it look like to really center women's health and, birthing people during their, for their reproductive health choices.
Jamila, let me come in here because I've heard so much, my head is just bursting here, the response.
Okay, I do want to say, and goes before you start, I just want to say one thing. We're going to do the next question quickly so we can start making our way towards the end. So come in now, say what
So-
you want to say.
This is a segue to the next question. What do we need to do? And because I'm an action-oriented person, when I am at these forums and I leave it, I want to say, well, how do I use what I learned there to make things better? I like a proposal just grew up here from this conversation. And I thank the Office of Public Advocate for facilitating this. Because accountability, transparency, and engagement of the voices of the people on the front line, the CBOs on the front line, and valuing it and respecting it are critical pillars for a shift in the paradigm. For instance, we have to keep our eyes on some new monies coming into New York City called the new 1115 waiver. It's the follow-up to the DISREP. When billions of dollars were spent to shift the delivery of care to be more community-centered, and community-based organization got less than they were intended to get up to 5%. If you take in total all the money that community-based organization got, who got any, it's less than 0.1%. And where is the accountability? Where is the measurement? Where was the monitoring? All we got is excuses. When some performing provider systems did pass the money to the community, we had to sing a song of gratitude for it because they did the best. You know, they did something. And so as we go forward, I like the idea of this app, and I would like those of us who are on this program after the show to get together and drive the movement for accountability, because you're right, technology and social media is the game in town now that can move mountains. It causes wars, it topples governments, and it elects people. And we are the ones. Governments will come, administration will go, but what remains? The problems in the community and the community advocates. And we keep going on regardless. So my proposal moving into the future is we use this opportunity and springboard action from this to start holding folks accountable. And if it means we have to look at your app and increase, modify it further, let's put our intelligence together, because we have to do what will work for us and stop waiting for somebody else to do it. We have to take that charge. We've been doing it. We've not acknowledged ourselves sufficiently together, but I think this is the time. And we do have a government that is more receptive to looking at health equity and inequities, and we don't know when this government leaves, if another one will come in that takes us further back or moves us further forward. So let's take this opportunity, and through the leadership of the Public Advocate Office, since the energy is coming from here, let's take a commitment to organize us to the next step. Because the last time I was on a conference, or the speaker said, I'm tired of sitting in conferences. I'm tired of talking about the problem. I need to know what next. What is the next step to really move us from talking about it to doing something of it? And Rome was not built in a day. And so we wouldn't get everything done in a day. But social media and apps are making things happen faster in weeks and days than they've taken years in other years. So Kimberly, I thank you very much, and I certainly like to engage. I know Chanel, we've worked with her, and Jamelia, but I think you have the answer to help making these institutions accountable. And I just got some news today that was sad about the president of the past connecting. Recently, a woman delivering in hospital with her doula around her, and this is a hospital in the city, was being forced into C-section even with the doula in the room, with the clinician saying, hurry up and get this done. Let's cut it and get it out. And, in this day and age, while we're trying to get hospitals to be doula friendly, and they're getting all this bias training and culturally sensitive all this training, right? This can be said and happen, and in the presence of advocates of the woman who can't speak for herself being under anesthesia. So that's it. Next steps.
I hear you. I felt the fire in Ngozi. I felt it. I even heard a little Guyanese accent come out. So I know you mad. But okay, so that kind of segued into question number 3. So really quickly, because we have just about 18 minutes left of this panel. We don't want to keep people here all night. And I want us to remember, again, shout out to all the partnering organizations, CVH, NYCLU, Nursing Association of New York, Black Social Workers Association, and so many others that have partnered with us. They have their members on this call. So these are the individuals who are ready to rock and roll. These are people who want to be activated, who want to be set on fire to join this birth equity movement. So I want to make sure we get through this so we can get to the call to action and people can start working with you all and also join us for part 2 in Albany, because we're going to Albany for Black Caucus weekend. And so Chanel and Kimberly, I want you to touch on, because Ngozi kind of touched on this already. So we already know that we're calling for birth equity and birth justice. There's no one quick solution. There's no silver bullet. But what's the playbook? What's your playbook? And I think you've spoken about this a little bit. Kimberly, you've mentioned about transparency and accountability. And Chanel, you've spoken about other things around policy. But what's the playbook? How do we get us there? What's the strategy? And I know you don't have all the answers, but like... in a nutshell, how do we move forward? Starting with you, Chanel.
Okay. I mean, I think we move forward with collective organizing. I think we really need to, some of the bills one bill that has recently passed is the birthing center bill. And so what does it mean now that that bill has passed, to see it now through complete implementation in an equitable way, as well as accountability to those who are really working really hard, like the birthing place, who has worked really, really hard, and other advocates to really get that bill passed. I think it's also looking at the midwifery bill that is currently in place, right? And really like lifting that up and supporting that. You know, we really need to have spaces where midwives are the touch point. You know, they're the touch point for community care. I birthed my children with a midwife, home birth midwife. They're great advocates, as well as like they're a source for community liberation, you know what I mean? And really us having other places outside of hospital-based institutions to really be able to center ourselves. And so looking at different designations such as CPMs, direct midwives, to be able to be in place, not putting all of the burden on doulas and the infrastructure of doulas, because that is not that is part of the answer, but that is not the entire answer. And really looking at a broader spectrum of that. And then again, I have a list full of different policies that are in place that center, like an extension of Medicaid during the postpartum period, looking at health insurance and reimbursement by private insurance companies for doula services. And so if you're interested in, finding out more about the policies that are currently in place, please feel free to hit us up online at ancientsongdoulaservices.com. We're open to sharing that, as well as join and subscribe to our newsletter so that you can stay in the loop when we have action items going out in terms of advocacy and the ways that you can get involved. Again, I don't think that there's any one-pronged approach, but I think us all collectively working together. And as Ms. Moses said, like, my wheels is turning. I'm like, oh shoot, I see something in the works. It's about to come to play. So, really like having a conversation, a deeper conversation with all of you, and like, what does that look like, and expanding that outwardly so that we can really be a force for change for individuals birthing people in New York City and the state as a whole.
And we definitely want to be a force. And you mentioned birthing people, and I also just wanted to take this moment to lift up our trans and gender nonconforming community. And I know, Kimberly, you did a nice conversation with a birthing person, I think earlier last week, and they were speaking about their experiences giving birth. And we got to get on that too. We got to get to that as soon as we finish this. So Kimberly, you want to just close us off on this third question?
Yeah, I just want to really echo what Chanel is saying about the policy, and just this idea that we need more out of hospital options. This hospital system was never made for us, right? The whole history of OBGYN has been oppressive to Black women's bodies. And so we have to recognize that while we're working for systemic change through all the means, that we also deserve more out of hospital options. Birth is not a medical event. We learned during the pandemic the folly of sending people who are not sick into buildings built for sick people, right? And so when we treat birth like a medical event, when it's not for the majority of people, we end up in a more oppressive situation. We end up with more C-sections, all the things that ultimately are the pathways to higher maternal mortality. And so I just want to honor and restate the need for us to push for more childbirth centers, certainly more Black-owned and community-centered childbirth centers, being critical to that. And so that being a critical piece of it. Mama Ngozi, all of your energy was just giving me life this evening, and thank you so much. Please ask that mama who got that C-section that she did not want to leave a review on the Earth app. This is really our work, right? When we hear these stories, and we always do, we can't let them just sit within our community and with those that we know. We need to put them on a platform where they can be a tool for change. So I want to invite everyone, if you go to the Google Play or Apple App Store, download the Earth app, tell a friend, a family member, if you gave birth yesterday or 2 years ago, leave your review. Prenatal, birthing, postpartum, pediatric, our experiences matter. But if we put them together, I promise you that me and my team will fight to push for systemic change. We turn all of those experiences into data, and we identify what's going right, who's failing us repeatedly, and then we go and we, make a little visit. And now I'm going to have to ask Mama Ngozi to come with me in some of those calls because her energy is much needed. And so I think it's really, really critical that as we're thinking about the way forward, that we just remember, I think what we talked about here, this blueprint of bringing all the things. Unfortunately, it's not going to be just about policy. It's not going to be just about community-based organization. It's not going to be just about technology, but together, all of those things are really powerful. And I really want to honor what you said, Jamila, just around so many things happening. How do we work more collectively, and how do we work, more in concert and not just in agreement, so that we are kind of aiming ourselves and putting our collective power, not just our collective power in our work around a technology platform, but our collective people power in one direct goal. And one of the things that I've learned is that when people get together and create an agenda, like this is what we're all focused on for year one, this is what we're all focused on for year two, and we get everything that we have behind that shared agenda, right? I think we've had a shared passion, we've had shared interests, but we may not have had a shared agenda and action plan, right, where someone has said, you know what, this year we're pushing for this, and everybody's focused on that. This, or these are our top 3 priorities, right? And that we can direct that, because what we need is collective power, whether we're advocating for policy, whether we're advocating for funding, whether we're advocating for more technology-based platforms. And so I want to just honor the spirit of Earth, which is rooted in collective community power, that I think is another piece of us having not just a shared interest, not just a shared passion, not just a shared outrage, but a shared agenda and an action plan. And so I think that is also critical to how we take this movement forward, instead of having all these amazing things happening, but not in concert. Not
in silos.
Yeah.
Sorry, I didn't mean to talk over your last word. Okay, so we have to our live, we have about 10 minutes and 15 seconds left, and we have some questions in the chat. And I want to honor the people who came to sit with us today and ask these questions, because they're asking them because you 3 are experts. You're the heroes of our time. And that's why this is called the Rebirth of a Movement, because this movement is not brand new. It started a long time ago, and we are breathing fresh life into it. And that's needed. We're coming. It's like the baton is being passed. And, for some time I felt like, who are the advocates that are coming behind Chanel and Ngozi and Kimberly? But they're coming, and we're going to create more people to kind of keep pushing. So that's why we're having this conversation. So I want to get to some of these questions. I'm not sure if y'all had an opportunity to kind of look in the chat. Faraine has been dropping them in there, and shout out to community organizer Faraine from our office, who's been doing an amazing job creating this coalition for us. So I'm going to start from the top. These are lightning questions. So whoever wants to take the questions, feel free to just jump in. I'm not going to tell you, you just tell me, and try to see if you can get it answered in 30 to 45 seconds. Okay. Let me see if I can find the first one. It says, hi, are there any organizations that offer scholarships for doula training? Who wants to take that?
I'll take that because we don't just offer scholarship. We train. Brooklyn Perinatal Network offers training to doulas. We select people from the community who are interested, and we train them at no cost to themselves. We provide the training, and then we engage them in service contracts to provide the delivery. So you're actually building community capacity by training community women to become doulas, and it's free.
Got it. Chanel, you wanted to say something. Oh, sorry, Ngozi. I thought you were done. Go ahead.
Yeah, I'm just saying that they can contact Brooklyn Perinatal Network for further follow-up. They can find us on the web.
Got it. Faraine dropped your website in the chat.
Okay.
Yeah, I just wanted to add that Ancient Song will be offering two. We previously used to do it, and I saw in the comments some of the doulas that we trained, but we will be offering 2 free community doula trainings in a couple of months and have that information up. It is based on application, and so folks will fill out an application, but this is for folks who specifically live and work within the Brooklyn community. And the all of the other boroughs. And so please look out for that information coming forward soon.
Okay, our next question is, what bills are you all currently advocating for? Maybe if you can drop your top 3, if you have a top 3.
I'll go, and if my staff is hearing me, maybe they can, I don't know if they can pop the bill up now, but Assembly Member Jackson and State Senator Myrie have together in the Assembly passed, and in the Senate proposing a bill that is called the Chisholm Chance Act. And this bill is asking for the state legislative to provide money to fund a particular community-based service coordination and sustainability program model for Brooklyn and Bronx, where it's called the Community Pathways Hub for Brooklyn and Bronx, where the infant mortality crisis in New York is centered, with 8 Black women to 1 white woman dying in childbirth. And for every 1 death, 100 near-death misses occur. A lot of them from C-section and other related crises occurring during the delivery. And so that bill is Senate Bill 322. We're asking everyone who is listening, if they're interested, to really help get a memo of support from your organization to Senator Myrie. And BPN has that memo. We can provide it. Folks can reach out to Brooklyn Perinatal Network, ask for Edlin Jackie. I wish someone can put her.
We'll put it in the chat.
In the chat, yeah. And so that's the bill. And the reason we're promoting that bill, the Chisholm Chance Act, is based on the memory, supporting and advocating for the memory of Shirley Chisholm, the first Black woman to run for president. And I want to use 2 quotes that from her that is relevant for us at this particular time. She said, "Service is the rent we pay for room on this earth," which means all of us have an obligation to really advocate. And if they don't give you a seat at the table, bring a folding chair. So here is the opportunity to bring your folding chair by supporting this memo to get it passed. Senator Myrie needs 30 legislators to sign on the bill to get it passed. This is the 3rd year.
I'm so sorry. Are we still here?
Okay. So that is the bill I'm supporting, the Chisholm Chance Act.
Okay.
S322.
Got it. Okay, so we're gonna get through. We have about 4 more minutes, and we have maybe 6 or 7 more questions. So if we could just answer them quickly as we can, so we can get to as many as possible. Okay, so Chanel, did you have a bill that you wanted to highlight? And Kimberly, if you have one, you can go right after, or we can go to the next question.
Yeah, so I wanted to highlight Senate Bill S1172C, which it relates to the provision of informed consent. And the informed consent bill is really important in regards to substance uses in pregnancy. And so when we start to look at patients not truly having informed consent to knowing that they're going to be drug tested, and that information is thereby going to be used at the Family Regulation System, or ACS, Child Protective Services, and thereby put them into that system. And so really pushing for the informed consent bill as it centers substance usage, as well as the Omnibus Act, the Build Back Better Act that is currently present, and then extension of Medicaid extension during the postpartum period for up to 1 year. And so those are just some. There are, again, a host of others, but just wanted to name the top ones that I could in this moment.
Got it. Kimberly, did you have one, or do you want us to go to the next question? Okay, so we'll go to the next question. We also don't want to keep you for dinner. Okay, so the panel of experts, sorry, let me just read this quickly. Okay, Governor Cuomo put together a panel of experts in 2018. Are they still assessing the reproductive landscape? So that looks like a negative.
No.
I don't know that they are. So
I was a part of the 2018 convening, and there hasn't been any movement in that since 2019, early 2019. And again, I think that's how, political powers use things to leverage a particular landscape and topic at a particular moment. And this is why it's important to really follow through with implementation and accountability strategies. And so where good efforts come into play, but then the follow through towards the end, or how it's being implemented, is really important.
And that reminds me that the media is just like that. They like bite-sized moment that hype up around a problem, and then it peters out and we have to ask what has happened. So
okay, I have a quick question. I'm not sure if we can answer it. If we can, if one person could just take it. What are the plans for licensure for all midwives and funding to support out-of-hospital births? I'm assuming they're talking about birthing centers and midwifery centers. Does anyone know if there's a plan for that in terms of policy? I think that might be the two bills that you mentioned before, Chanel.
Okay. Yeah, those are the two bills.
Okay. Let's see. I would love to hear thoughts about what policy legislation we can push for that provide more support. Okay, this one says, I would love to hear more thoughts about what policies legislation that we can push for that would provide more support during the postpartum period, both in terms of physical and mental health.
So again, currently right now, I would say, there's the extension of Medicaid during the postpartum period, which hopefully will cover mental health services, but it's a big hope. And so we really need to look at what that looks like on a deeper scale.
Okay, next question. What can you do, I don't know if they mean us or them, to help postpartum health and women's health in their, okay, let me read this again. What can you do to help postpartum health in women and their safety?
I think all that we're doing, reaching for recognition, value, and resources to do our work better, is what we can do. Health does not happen in silos, and we all have to work to get all parts of the healthcare system working together to support the work we do in a coordinated way. There are upstream factors and downstream factors, and the system tends to focus on either upstream, downstream, medical, clinical, social, rather than bringing it all together. And the only folks who are like in the center, serving to be the glue to bring it all together is us, and we need the support of everyone who is in the audiences of these forums to help us. And I like that app that was mentioned by Kimberly, so that when we have these forums, maybe we can find a way to use those apps to reach out to people after to say, do you want to be engaged? Or maybe have them put it in the chat, do you want to be engaged? And we pick it up right away and start to build the momentum further for the things that are active. But we are doing a lot. We can do much more. We need more resources and more voices, and to be at the tables where power and policy and influence plays out.
Okay. And then
Jamila,
we
can I
had
just
some
say
extra.
something very, very briefly about that? So 2 sentences. One of the most important things we can also do from a community perspective is acknowledge the 4th trimester, right? We're normalizing this language that the postpartum period is actually an extension. And when we can acknowledge that there is a 4th trimester, that there is is it 5th trimester? Okay, 4th. That there is an extended time where we are still needing postpartum care, where we are still dealing with things. Many of the Black maternal deaths are happening in that postpartum period. So as a community, we need to have awareness of some of the medical risks around hemorrhaging and infections. We need to have community awareness around some of the emotional issues around not just the baby blues and not telling people that they could pray it away or drink it off or whatever. We really need to, as a community, build our knowledge and acknowledgement of this critical period. And I think that would be great of help, because we know that we support each other as a community, our sister friends, our church groups, our collective knowledge as a community is also vital to this time.
I would just important piece. Postpartum perinatal mental health is critical. And mental health services in general are a huge deficit in our community. So any bill or any legislation that is addressing mental health is critical. Mental health is an underlying factor in health outcomes before the pandemic, and during and post-pandemic, it will increase even more. So increasing community awareness about the need for mental health, the availability of mental health, and mental health sources that are non-conventional, that are culturally appropriate. We all don't have to see a psychiatrist to get mental health. There are other resources that are available that need to be further developed, culturally relevant resources. I could mention one organization I know in Brooklyn, LK Wellness in Flatbush, that is pushing out culturally competent indigenous approaches to mental health wellness and prevention.
Okay, thank you for that. With that, we're going to close off the questions. There were just 2 comments in there. I just want to give you, I think 2 people were agreeing that yes, CBOs need funding and they need a living wage. So I just wanted whoever wrote that comment to know that we see you and we hear you, and we're taking note of that. So now we're going to get to our call to action. This is our lightning section. So we've been on for about an hour and 5 minutes, and we're going to return everyone back their time so they can have dinner and do whatever they must do with their families. In 1 minute, can you please give us your call to action and tell us where and when to join you in the fight for equity?
My call to action is to ask everyone who is listening, if you're from an organization, whether it's a civic organization or faith-based organization or a community-based organization, to sign on to these bills that you've asked about. Particularly the bill that I am asked you to sign on is Senate S322 bill, the Chisholm Chance Act, by sending memo of support to Senator Zellner Myrie to get that bill passed in this legislative session.
Okay, thank you. That's good. Chanel, what is your call to action?
Yeah, my call to action is if anyone is interested in being on the front lines and doing more advocacy work, we're looking for volunteers and those who are interested in doing that work and really making phone calls and, starting to engage with folks. We will provide the resources necessary for you to be able to do that in an equitable way. And then, you don't have to wait for something to change. You know what I mean? You can be an active participant as well by spreading information and knowledge to your community members, by sharing resources, and by continuing the conversation about talking about birth equity and centering hope. Yeah.
Okay. And I'm going to go to you, Kimberly, in a second. One of the things I did want to uplift before we go back to Kimberly is that the Public Advocate also has legislation. We just this last Thursday reintroduced 2 of our bills. One of them is a bill that would it's a respectful care at birth bill, which allows hospitals to use the same mechanism that they're using in some hospitals, which is to provide women with their education and their rights about proxies and what their healthcare rights are in all hospitals across the city. And then also we have another bill that's targeted at parents who are returning to work after birthing children, and how their employer has to assist in the process to reorient them as they go to work. Also knowing that many parents, after they have a child, sometimes it's hard to assimilate back into the workforce. So just wanted to drop that there. And people could always check in with our office and support some of the work that we're doing. Did Kimberly come back on? Hold on, let me see. We got Kimberly back here. And so Kimberly, you're the last one. What is your call to action? And then we're going to wrap up and send everybody home.
Well, it was so great. Thank you so much for this amazing conversation. My call to action is just really a reminder that we have power, that we have collective power, that we have community power, and that in this narrative of Black maternal health, where we're often hearing about the statistics and the lacks, and that our communities are needy, that we should remember who we are as a people. Resilience has always been how we survived. Our joy has always been how we survived. And by working together, our collective power has always been how we survived. And so whether we are leveraging that on a digital platform like Earth, through community engagement, through policy advocacy like Chanel is leading, through community-based organizations with Mama Ngozi, our collective power is our power to achieve birth equity and justice. So I just want to leave everyone with that reminder.
Okay, great. So thank you so much, Ngozi, from the Brooklyn Perinatal Network are you speaking to us or are you on? Okay, thank you, Ngozi, for taking time out this evening with us, and all the words that you have said that were encouraging, and for bringing your fire. We do consider you a mother of the movement, and we're grateful for all that you've done. This is Women's History Month, so I don't want to miss the opportunity to thank you and to celebrate you as just being a woman that's been a trailblazer in the maternal child health movement for decades, and we owe a lot to you and some of the work that you've been doing. And with that, I also. Sorry, you wanted to say something?
No, I just said thank you, and I would just like to emphasize that health does not happen in silos. So we need to leave knowing that we have to come together and continue.
Mm-hmm. Okay, and Chanel, thank you so much for your fire and your passion. Again, you are one of today's sheroes. I've been watching you, and I'm sure that many other young women and women across the country are watching you and listening to the spicy pieces of advice that you have to offer. And we're excited to have you and glad that you're one of us and you're part of this fight with us. And Kimberly, the app and the way you're taking this technology conversation and bringing it into this healthcare conversation is amazing. I love to see our women of color on some of the highest levels. And when I saw your shout out and Kamala Harris's announcement, I said, yes, I'm happy it was you and that you're doing this work. There are many people doing this work, and I'm glad that you're part of this work as well. With that, I just want to hand it over to Farias Griffith, who is our organizer. We also want to thank our public advocate, oh my gosh, for all of the work that he's been doing. And also we want to lift up his wife, India, as she's going through her healthcare journey. We want to make sure that we support her. Please give her your thoughts, your best wishes, and your prayers. I'm going to bring Farias Griffith up so she can just close us out and thank our partners.
Good evening, everyone, and thank you for joining us during this conversation. I'd like to thank our partners, Ancient Song Doula Services, Brooklyn Perinatal Network, the Earth App, Black Women's Political Club, Bronx Healthy Start Partnership at Einstein College of Medicine, Supporting Healthy Relationships at Montefiore Medical Center, New York Civil Liberties Union, known as NYCLU, and Association of Black Social Workers, the New York City chapter, Community Voices Heard, and the New York State Nurses Association. Thank you so much for your partnership, and we look forward to continuing on other collaborations. Thank you all.
See you in Albany.
Right.
Thank you so much, too, friend. Good night.
Good night.
Good night, everyone.
Good night.
Good night.